If you're new to this channel, you may consider subscribing and hit the bell icon so that you continue to receive the updates. Please share it with all others who might benefit. Let's get started. A common problem when dealing with datasets of any size is the presence of duplicate rows or duplicate records. And a common solution that you'll see all the time is that we drop duplicate rows. But is it what we should be doing? In this video, we're going to particularly emphasize on how we should deal with duplicate rows, and this will be an eye-opener for those who think dropping the duplicate rows always is the best idea. Let's start with an example. Let's bring a small data set where we have information about the patients. So there's a field called Patient ID. There's a field called age. Then we have the gender of the patient. We have the body mass index. We have blood pressure. And we have diabetes status. Now, in this data set, if you see, each patient is supposed to be uniquely identified with the help of the patient ID. But there are some interesting cases that we'd want to look at, and we'd like to ponder if we should always drop the duplicate rows or not. So let's pick the first case. These two records that you see have the same patient ID. So we have a unique identifier, and the records that follow thereafter are somewhat different. In the first case, you see the age is 45. In the second case, the age is 32. And the other measurements of body mass index, blood pressure could be close, but the diabetes status looks like in the first case is a no, and in second case, it's a yes. Now, in this case, should we drop one of these records? And if yes, then which one should we drop? Or should we keep both of them? So again, this is a domain-specific thing. If you're saying that you maintain a patient's history, and you have a history that goes back up to 14, 15 years, then maybe this patient ID, which uniquely identifies the patient, is for the same person. First set of observations taken when the patient was about 32 years old, and the second set of observations much later were recorded when the patient's age is 45. But if you're sure that this is the same person whose records have been captured here in two separate rows, then this data may still be useful. Because this talks about the fact this patient earlier was diabetic and now is non-diabetic. And could be the other way. And maybe you do not have this wide an age gap all the time. You could have maybe taken the observations 1 year down the line. And you might have found a change. If the person has carefully worked towards reducing the blood sugar level, you may find a change in some of these measures. But as long as the data point is genuine, we don't really have a problem. We may want to take the most recent record. And for treatment, often the history also comes very handy. So in this case, even though the patient ID is repeated and the values are different, this still might be useful. A domain expert can take a call. But to say that we'll just drop one of these randomly would not be a good idea. Let's move to a more common and easier case. Let's say we have two separate patient IDs where we have identical information. Like the way you see in this case, patient ID 3 and patient ID 9, they have exact same attributes. Now imagine, if the patient ID was not there, what would you conclude? You will say that rows are duplicate. But if these rows belong to two different patients, then what's wrong in that? There could be two patients who are male, who are 35 years of age, their body mass index is identical, their blood pressure readings are identical, and both are non-diabetic. In such cases, in the absence of the unique identifier, if you eliminate such rows, are you not underrepresenting a kind of data that your models need to know a little better? So eventually, you'd be using this data to do some kind of a modeling task. And people would argue the rows are identical, that the model is not learning anything new. Well, that's agreed, but your model definitely needs to know what kind of data it needs to emphasize on. If you have more cases of a certain age group, of a certain gender, of a certain BMI group where people are found to be diabetics or otherwise, don't you think your model needs to get more practice on that data during the training times? So in such cases, when you're not able to establish whether these records are copy-paste errors, which means just because of some ignorance, the data got entered twice, you are not supposed to remove the duplicate row. And in this case, when you have a patient ID available, of course you're not supposed to remove the duplicates. First of all, with the patient IDs being there, these rows will not be seen as duplicates. That's the importance of a unique identifier. So to sum it up, two possibilities. You don't have a unique identifier and you have rows which are identical. Try to figure out if these represent two different individuals or two different cases. If so is the case, then you don't want to drop the duplicates. Unless you're sure that these are just data entry errors. The same data has been entered twice. And if that's the case, you can simply go ahead and remove one of the records. Keep one copy and drop the duplicates. Same is the case here. We have a patient who is a female, 50 years of age, BMI values, blood pressure values, and diabetes status all are identical. But these are two separate patients. So we would not want to drop the duplicates in this case. So now that we have seen these cases, let's try to put this all together at one place with the help of a mind map. And that'll come very handy whenever you have to make a decision with respect to duplicates. All right, so we are looking at a mind map right now. It starts with a check. Data includes a unique identifier, yes or no. The unique identifier is duplicated, which means the unique identifier itself is repeated. Then you have some cases. Let's expand this. The observations are different. If so is the case, that unique identifier is repeated, but the observations are different, you may want to check if observations have been recorded at different timestamps. For example, in our case, we saw it was the same patient ID which was repeated, but it could be that the same patient's multiple observations were captured. And in such cases, the collective history of the patient becomes very important. When you're talking about an employee, let's say an employee ID is a unique identifier, and you want to, let's say, make a decision about employee's career progression, then not just one recent performance, but the entire performance history covering the association of the employee with the organization might be meaningful. So in such cases, the different observations could be utilized in a way that you want to probably summarize, take an average, or take another representation of the value. If these observations have been recorded at different timestamps, you may use appropriate method to represent the information instead of just dropping these observations. Now let's look at the second possibility. The unique identifier, UID, is duplicated and the observations are identical. Let's expand this and see what are the possibilities. Observations recorded at different timestamps. It is possible that even after some medication or some treatment, the observations stayed identical. That's not an impossible case. Maybe the person was healthy and remained healthy. Maybe the person was not so good in terms of health and remained the way he was or she was because of whatever reason. So if the observations recorded at different timestamps, you may want to take a call. Is there a merit in keeping those observations separately? Are you able to draw some intelligence out of it? If so is the case, then that's again a part of the history that you may want to consider that the patient did not respond well to a certain medication. You don't want to drop that trick. But if the observations were recorded at the same timestamp, obviously, then you don't need that observation. Why do you have the observation recorded at the same timestamp? You may want to remove it. And this is probably the only case where you can remove the duplicates with a lot of confidence. Why would you have the observations recorded at the same timestamp captured twice in your data? You can simply go ahead and remove them. But again, then you have to figure out, is it what happened? Do you actually have an error in capturing the row? You captured it twice by mistake? Remove it. Now, let's say you have a unique identifier that is not duplicated. In such cases, it's almost never a good idea to remove the duplicate rows unless you have a very sound reason to drop them. And in fact, this is the exact case that will apply to those scenarios where you do not have a unique identifier. If you do not have a unique identifier, the first thing you want to ascertain is that whether these rows which are identical represent two different entities. If yes, then you don't want to drop those duplicates. You want your model to understand that these kind of records are commonly occurring and are important for us. So this in a nutshell kind of covers the scenario how you want to deal with duplicate rows. Remember, the presence of unique identifier is always a good idea. So if you don't have a unique identifier in your data and you're at the data collection stage, you may want to incorporate that from the very beginning, else it might lead to confusions at a later stage. Hope this short tutorial gives you a good insight about treating the duplicate rows.